So hello friends, welcome to my YouTube channel again, and we talk about bones and human skeleton.
The structure of an adult bone includes shaft composed of periosteum, cortex, and medullary cavity. Periosteum is a fibrous membrane covering the surface of a bone, outer fibrous layer and inner cellular layer, which is osteogenic in nature. Cortex is made up of compact bone which gives it desired bone, and medullary cavity is filled with red or yellow bone marrow. The two ends of a long bone are made up of cancellous bone covering with highly cartilage, as shown.
There are 206 bones in our body, and they are divided into axial skeleton and appendicular skeleton. In the upper limb, we have clavicle, scapula, humerus, radius ulna, carpus, metacarpus, and phalanges, as shown in the given picture. Now in the lower limb, we have femur, tibia, fibula, tarsals, metatarsals, and phalanges, and also the hip bone. The blood supply of bone is given by nutrient artery, metaphyseal artery, epiphyseal artery, and periosteal artery. Bones are highly muscular and have the greater regenerative power, and it can mold itself according to the stress and strain it bears. Now we will talk about the anatomical position. In it, the body should be erect and straight, and head, eyes, and toes to be facing forward. Limbs at the side of the body and palms directed forwards. This is shown in the given picture. Now, in the clinical anatomy, we have the rickets, which is caused by deficiency of vitamin D. Deficiency of calcium causes osteoporosis in the old age, and deficiency of both calcium and vitamin D causes osteomalacia.
The young bone consists of ends of bones which ossify from secondary center are called epiphyses. Then we come towards diaphysis. The elongated shaft of a long bone which is ossified from a primary center is called diaphysis, and metaphysis is the apical end of the diaphysis are called metaphysis. The epiphyseal plate helps to increase the bone length. Each metaphysis is a zone of active growth. After epiphyseal fusion, metaphysis is richly supplied with blood through and arteries. This is the picture given here of explaining the full 206 bone distribution as given in this picture. It consists of the human skeleton. It consists of axial skeleton and the appendicular skeleton. Axial skeleton is divided into skull, sternum, vertebral column, and ribs, whereas appendicular skeleton is divided into girdles and limbs. Girdle has two types, pectoral girdle and pelvic girdle, where limbs are forelimbs and hind limbs. There are 80 bones in axial skeleton and 126 bones in appendicular skeleton. Skull consists of cranial bones, hyoid bones, ear ossicles, and facial bones. Frontal, parietal, occipital, temporal, sphenoid, and ethmoid are the various cranial bones given in human body. Malleus, incus, and stapes are the ear ossicles, and nasal, maxillary, palatine, cheek bone, lacrimal, inferior, nasal concave, vomer, and mandible are all the facial bones as given. Our vertebral column consists of 7 cervical, 12 thoracic, 5 lumbar, 1 sacral, and 1 coccygeal. We all have 24 ribs in our body, where 1 to 7 pair are true ribs, 8, 9, 10 are false ribs, and 11 and 12 are floating ribs. Pectoral girdle of the shoulder consists of scapula and clavicle, and pelvic girdle consists of 3 bones, ischium, ilium, and pubis. Thank you, and hope so you like my video.